I'm Dr. Craig Escudé, the host of IDD Health Matters, a podcast where we talk about health, wellness, and health equity for people with intellectual and developmental disabilities. Hope you enjoy it.
The IDD Health Matters podcast is a joint production between Friends for Life and Intellect Ability. For more information, go down into the show notes and click the link where it says Learn More here.
Welcome to this episode of IDD Health Matters. We're coming to you today from the Illinois Developmental Disabilities Nurses Association Conference. We've got a great guest today, Sharon Parker Love. Welcome, Sharon.
Thank you.
So, Sharon, tell us a little bit about how you got into the field of nursing for people with intellectual and developmental disabilities.
Well, I've been a nurse for 56 years, and when I've just like the last 2 years of my schooling, I found out about a state grant that all you had to do was work for the state in the mental health field. So I did that, and I worked for 2 years, and then I ended up working for 22 years.
So it's kind of one of those things, sometimes we get into this field and we're like, okay, this is for me, and we decide to stick with it, right?
Right.
Yeah.
And then I work, even now, 3 days a week, and I've worked for Trinity Services for the past 34 years.
Wow. So Trinity Services provides what type of services?
Okay. Trinity provides both people with dual diagnosis, meaning mental illness and developmental disabilities. Plus, we have a behavioral health section, and those folks are strictly mentally ill.
Okay.
And the rest of them are have an intellectual disability. And there's about 700 people.
Okay. So do you provide mostly residential services or day program services or
all of the above?
All of it. Okay. So pretty
even employment, and I started the group homes.
Okay.
And then I started and ran the behavioral health section for a while, and now I work for Illinois Crisis Prevention Network, and that is we help people to stay in their homes or their group homes, and we get them out of crisis so that they can continue living where they're living.
Okay. So tell me what type of crisis situations have you seen through the years? What do we really say? Yeah, give us a couple of examples for people out there who maybe don't know what a crisis looks like for someone with an intellectual disability or a mental health condition.
Well, I can think of a lady who was in the emergency room for 8 months.
Oh.
Her mother dropped her off and left her there, and she's got a syndrome, and she and somebody finally took her, and she deteriorated. So we're trying to figure out why she's deteriorating. Fortunately, she went to a children's hospital, even though she's not a child, but the syndrome that she has is childlike. I mean, it comes up as a child, and we hope to put her back together again.
So 8 months in the emergency room.
Yes.
Wow.
Right.
And that's no way for anybody to live,
no.
Is it? Yeah.
No.
Wow. And that's some of the type of work that nurses do in this field.
Right.
Do you have any other? How about a positive story? Has there been a really good outcome that you've seen with some of the work that you've done with people?
Quite a bit. I mean, most of them are positive. I have a lady that had or has charge syndrome, and she was upset and unable to. She was extremely, like I said, nervous and anxious and all that stuff. And we figured out what the problem was. One of them was that she had a migraine, and we, the mother and I, worked on transferring her, because she is both deaf and blind, and we transferred her over to a hearing facility so that she can communicate.
So how do we determine that someone who has a tough time using words or doesn't use words to communicate has migraines? How did you figure that out?
Working with her mom.
Okay.
We think she has migraines, so I told her to go to a neurologist or someone to determine that, and then.
Okay. And when I'm guessing treatment was started for the migraines, and she got better?
She's calm.
Wow.
Yes.
Yeah. That is a perfect example of something that I talk about all the time, about how so many times adverse behaviors, aggressive behaviors, self-injurious behaviors are really a result of a person who's having some physical discomfort.
Correct.
From some sort of treatable medical condition.
Right.
And that to me is why it's so important for clinicians to be taught these things. And I don't know about you, but I wasn't taught anything about this in my medical school training. Were you taught it about?
No. And there's a, what do I want to say? I feel that people should be observed, and you get to know what they do and how they are, and because a lot of times the direct care staff is the one that's observing them. So I need to teach them how to observe them so that they know what they're looking at, meaning in terms of symptoms, and that way you can get it started before it's bad. For example, we had a guy who was losing weight, and I said, "Are you losing weight on purpose?" And he said, "Yeah," because he was heavy.
Okay.
But unbeknownst to me, he was vomiting blood on the night shift. And the person on the night shift didn't know what that was like. So that got me started working or promoting signs and symptoms so that the direct contact staff would know what was going on and report it to the nurse or something along that line.
That again is another great example of what nurses do in this field, and part of it is teaching. And the importance of teaching support staff, because as you're right, so many times a direct support professional, they're the first line. They're the people that are with the person in support most of the time, and they really do need to understand and recognize early signs of health problems that are brewing and know what to do when they see them.
Correct.
Yeah, yeah. That's a big part of I think what we all do in this field. And for me, I had to learn a lot of those things the hard way because I wasn't taught those things initially. Mm-hmm. And I'm guessing you probably maybe had similar experiences in your career. I mean, you know, as a nurse, you know what blood looks like in vomit and what to look for, but the different ways that so many things present in people with IDD.
Right.
Yeah. And, you know, how about dental issues? You know, typically I think when we talk about health, we don't always think of oral health, but I bet a lot of times in your in your career, sometimes there's been people that have had dental problems that have caused that.
Or they might hit their ear, or they might lash out in some kind of way because they can't tell you that they got bad teeth or any of that. And it's very important to be observant. And I tell folks that people with intellectual disabilities can't tell you that there's something the matter because they don't necessarily know. And people with mental illness don't tell you. So you have to be a Sherlock Holmes and a pediatric nurse in order to make sure that you support and get things, get situations under control early.
Yeah, I think that's great advice. And, for people who are looking at this as a career, which is one of the reasons we do this podcast, is so people understand this field better and can learn about it and know what's involved and hopefully encourage people to come into this field, because goodness knows we need more people working in this field at all levels, including nurses and direct support professionals and others. But that's a good trait or component, I think, of this field is being able to investigate,
Correct,
and figure out what's going on. And a lot of times when I'm doing presentations, I'll present a case study, but it's never, it takes me 5 minutes to present a case, but it might have taken 6 months to actually figure out what was going on, because it's challenging.
Yes.
It can be very challenging to know why someone is having some sort of adverse behavior or self-injurious behavior. But the thing is there's usually a reason.
Right.
It's usually not just because they have a disability, which is what we hear so many times. Oh, they do that because they have a disability.
Or they also say, that's behavioral.
Mm-hmm.
Well, find out why they're doing that. So
Right. Right. I agree. Not just treat them for it, right? Find out why. And many times it's medical, but it could be an environmental situation. It could be a social interaction situation that the person is not happy with, but they can't tell someone, hey, I don't like to sit in this room because it's noisy, or I can't sleep well and I wake up at night because every time I lie down, I get this burning pain in my chest. What could that be? You don't get that information, but you might get the symptoms of somebody waking up screaming in the middle of the night.
Right.
And people think, oh, they're not sleeping well, they're having nightmares, but maybe they're having reflux or something like that, huh?
Mm-hmm.
Yeah. Yeah, but you've seen a lot of those things through the years.
You name it, I've seen it.
I bet you have.
Friends for Life Residential Care, specializing in support for individuals with developmental disabilities, offers services like adult day support and home health care. Emphasizing empowerment and quality of life, we live by the motto, my ability is stronger than my disability. We are currently hiring, welcoming those passionate about making a difference. Learn more and explore career opportunities at friendsforliferc.com.
I'm Dr. Craig Escudé, President of Intellectability. State developmental disability agencies, managed care organizations, and providers across the United States use Intellectability's health risk screening tool, e-learn courses, and person-centered training to improve health equity for people with IDD. Visit replacingrisks.com to learn more about how you can employ these tools with people you support.
So one of the things I like to do on the podcast is ask guests to tell us 3 things in 3 minutes, but you can take as long as you want. But 3 tips, 3 words of wisdom that you have that you think can improve healthcare, or supports and services for people with IDD. Anything you want.
A lot of times I meet people on the street and they don't know, so they can't, they think, oh, they're mentally ill, or oh, they're this or that, and they won't even come close to them.
Mm-hmm.
They need to be aware that everybody's a human being, and that they have needs and wants just like we do, or, I mean, everybody does.
Right.
And they have a right to live in this environment, whatever environment they are, and you try to make it better.
Yeah, getting to know people with disabilities and seeing them as people first.
Correct.
Is a very important thing.
Yes.
Yeah.
Mm-hmm.
What other tips do you have? What other pieces of advice do you have?
Well, from as I was saying earlier, to be extremely observant so that you know what's going on with the person.
Good observation skills.
Yes.
Yeah.
Yes.
Yeah.
So one of the things that it's always been fascinating for me to work in the disabilities field, because if you have a person with a, say, a gallbladder disease,
Mm-hmm.
maybe you have 2 or 3, you know that down pat.
Yeah. Yeah.
Okay, if you work with people with mental illness or even developmental disabilities, you don't have nothing down pat, and you have.
I couldn't agree more with you, because each person is different.
Yes.
And they show signs of illness or environmental situations or whatever in different ways. So you really have to get to know each person, right?
Right.
Yeah. Yeah. Great advice on all 3 points.
Okay.
Good observation skills, see people with disabilities and mental illness as people first with needs and wants. And the field is interesting because it's certainly not something you will get bored with in terms of thinking you know everything, right? We're always learning. Yeah. So great advice for people out there. Sharon, I thank you so much for taking the time to talk with me today, and so much more for what you've done in this field and what you continue to do.
Mm-hmm.